Welcome along to the World of Nursing Now podcast with your host, Janelle McSwiggin. Join us as we venture beyond the hospital corridors, embarking on a journey through the diverse realms of nursing. Explore unconventional pathways, from the captivating universe of medical writing to the uncharted territories of non-traditional nursing roles.
Welcome to the Nursing Now podcast. I'm here with Kristen Gilmore, and we're going to dive right into it because she has a really interesting role. So, Kristen, welcome to the podcast. I'm so excited to have you. So, you are the program manager for nurse well-being at Jefferson Northeast in Philadelphia. Do I have that right?
You do. Thank you so much, Janelle, for inviting me to be a part of your podcast and really just allowing me the opportunity to share with others what I believe is my calling in nursing and the work that I do. Yeah, and you got it right. I am the program manager. I'm the inaugural program manager, so I'm the first of its kind for nurse well-being, and I cover the Jefferson hospitals, the Bucks campus, the Tarsdale campus, and the Frankfurt campus. So 3 campuses that span between Bucks County and Philadelphia.
Wow. Well, first of all, congrats on finding your calling in such a broad, spectrum of nursing. A lot of nurses aren't that lucky to find their calling right now. So I found mine too. So it's really nice to just find your puzzle piece in the world. So congrats on that. And so this is a really unique role. And I've never heard of this role before, but it really speaks to my core of what nurses really need to feel supported in the current healthcare climate. So can you talk a little bit more about what that role means?
Yeah, absolutely. So like I mentioned, the role is fairly new. I'm the first one who had the opportunity to be a part of it, so definitely feel blessed in that way for sure. The role's only been around for about 2 years now, so we're 2 years into the role, which is really exciting. And the role is really based on identification to support nursing in a very different way than we traditionally have previously, right? To your point, like you just mentioned, like just recognizing that there's such a need out there to support folks in a new and kind of dynamic way. So my role, Janelle, is really funded through a grant. It's a very generous grant that came from our board of trustees within the legacy Jefferson Northeast. And my role was created by our CNO, Dr. Michelle Connolly, who is absolutely visionary in the nurse well-being space, and really is the reason that this role exists. So my role is to come to work every day, Janelle, and to support anybody who falls under nursing. And that can be nurses, orderlies, patient care techs, monitor techs, the list goes on. So it's anybody who falls under that nursing umbrella within our organization to really support them in a holistic space. So maybe that's emotionally, maybe it's from a mental health standpoint, which many times it is, to be honest. But it can also be from a physical, financial, spiritual way. I'm here to help. What I tell people in a very short kind of like little nutshell, because there are questions like, what is this role? I've never heard of it. You know, similar to what a school counselor does for students is kind of what I do for folks who are in that nursing space. Yeah, so very exciting. So I do a lot of one-on-one kind of conversations and interactions with nurses. And a lot of those interactions and conversations are surrounding some sort of event. So it could have been a workplace violence event. It could have been a medication error. It could have just been hey, I was trying to communicate with someone and it didn't go well and it left me feeling maybe a little uncomfortable. It could be I'm a new nurse, I'm new to practice, and I'm having trouble transitioning into the role, or I'm having trouble, feeling like I fit in, or I just went to night shift and I have no idea how to sleep or eat or when to talk to people. So it can really be any of those sort of ways. And I get the information on how to support people in different ways too, Janelle. So it can be through like our various OnPoint, what we call OnPoint. It's our structured system to reporting. I have a really wonderful relationship with our nurse managers. So they will send me emails about, hey, there's an individual who seems to be struggling a little bit. Would you mind reaching out to them? Or I'm, heavily embedded in our culture. So I round very frequently. People approach me, people text me. I'm very accessible. So there's various ways for people to be able to be referred to me or to be in contact with me. That's the bread and butter, I will say, of my role here. I'm, of course, involved in tons of different things as it relates to kind of helping to create a healthy workplace and healthy environment and what that looks like. I most certainly support different areas as it relates to safety and security. And I also have the opportunity to do really fun things where I've been able to develop programs and support them surrounding pet therapy for nursing, music therapy. Yes, it's so exciting. Different art therapy adjuncts, really trying to change what the landscape of, nursing looks like in that area of well-being, and really trying to create structure, and start it from a culture of, from the moment a nurse enters into our organization, that this is, the standard of what we do here in terms of having a commitment to our nurses and their overall well-being.
Absolutely fascinating. You touched on so many cool points right there. Like I was taking notes. So cool. I love how you mentioned that it's not just nurses, it's all like the support aid under nurses. I think there's such a division within the healthcare community by specific credentials, and I think it's like really dividing and it really doesn't serve many people when we are so divided. So it's really cool that you don't stop just at a specific license, that you really are like an over encompassing support role for so many different people. So that's really cool. I like how you said that there's a reporting system for incidents. I am always a really big advocate for reporting workplace issues, because if the broader facility doesn't know that there's an issue, they can't support you. They can't help you. They have no idea what's happening when they don't have like feet in that specific role. So how can they support retention, support these horrific shifts where everyone's running around if they don't know about them? So I'm always telling nurses to report these things. So it's so cool to hear that you have like a reporting like hierarchy system in that.
Yeah, absolutely. And one of the things that I did when I first came into this role, Janelle, was I really tried to meet with as many nurses as I could, whether that was at the local level or our regional shared governance level, to just share with them the importance of reporting and what they can report, right? I even talked to them about reporting things like bullying and incivility. There's a space for that in our incident reporting system. Of course, workplace violence and all the other things that fall under that typical cascade of reporting systems. But to your point, I shared with them something very similar of, if you're not reporting it, we don't know that it's happening, and we can't help to support a culture change, and we can't help to support that healthy work environment if we don't know. So it's really important. And our folks here in risk, and in safety and in quality have done so much work around those incident reports to make them easier so that they don't take a really long time, so that it's easy for the user. So we really try to encourage that practice, that best practice, and we are a just culture. We want to know that these things are happening so we can help to support them.
Absolutely. We're such an evidence-based like system overall that how can like I said, how can we support if we don't have the evidence for that? And I've also talked to so many nurses, and frankly, they don't know even how to report. There's no system in place. They're like, well, we're night shift, and I like my manager's on like B unit, I'm on A unit. I don't even see them during the night. So I love that it's like a remote thing that they can just like put a ticket in, let the person know what happened, and then there's some sort of a resolution, which is also very comforting to the nurse that their voice is heard, that they're not just being swept under the rug because there was no management on for that shift, or that they didn't have eyes on their manager, that they have like some sort of a debriefing moment regardless of who is on that shift. So that must be like really therapeutic to them too.
Yeah, and I always tell them, when they even just start in our organization, and I talk about it, I said, if you ever hear my voice on your voicemail, please know it's never to, I'm not calling to examine an issue that happened. I'm not somebody who's involved in the investigation. I'm truly calling to check in on you to see if you are okay after an incident that happened to you at work. That is my stake, and my stake is in your well-being. I'm interested in you and how are you doing. So I
I
really
love that impartial, yeah, that impartial moment. You also touched on resources through OnPoint. Is that like a resource like hub that they can go to?
So OnPoint is our incident reporting system.
Oh, so
But we do, Janelle, that's what you bring up a great point. We do have a space within our whole enterprise where anyone who works for our enterprise can go, and they can find every well-being resource that we have for the organization. And we just now, because we have amazing marketing people, we have a QR code that people can literally scan on their phone. They sign in using their credentials, and it brings them to our platform. It's called Healthy Living, and it's where all of our holistic health offerings live. And it can be webinars, support groups, virtual learning modules through LinkedIn. It can be phone numbers, resources, departments, anything you could even imagine. And most of the resources we have here are free to our employees and people that live in their home. So we really try to make sure we're supporting folks at home as well.
Yes, the entire family. Yes, I absolutely love that. I keep hearing like the same thing from nurses too, that like they struggle with like feeding themselves, or they struggle with regulating their emotions, or they struggle with sleeping. You mentioned that shift change from day to night shift. The nursing world can be very like stimulating and ever changing and very provocative to your emotions. So it's really nice to hear that there's one place that they can log on without necessarily having to seek someone out to have that conversation and to be vulnerable. Because I also think a lot of nurses struggle with that vulnerability because we want to be that beacon of strength for one, our family, but also our patients. And yeah, we just have like a hard time with that. So I love the QR code. I love that they can find their resources on there and that they can tailor it to what they need, because I do hear so many different struggles from nurses, but some of the same revolving things. So I can see you definitely covering it from a holistic point of view.
Yeah, and you hit the nail on the head. Like there's just so many, it's an ever-changing landscape we're in nursing, right? From minute to minute, literally. It's not even just shift to shift. So your need as a human being can change so often. And we really try to make sure that we have focus on that and that we have tons of resources for folks available. For what you said, like it could just be simple as like nutrition. Like I'm not sure what I should be doing, what my goals are, and it could be sleep. It could be, I'm working days, and then I'm working nights, and then I'm working days again, and I'm having a hard time. And again, just giving them those resources. And you are right. Sometimes nurses can be a little challenging in the well-being space, but to have that individualized kind of approach where folks can just log on at their ease, at their home, at their workspace, and they can just go on and kind of anonymously and go through and see what we have to offer. I think that offers a ton of opportunity for them to take care of themselves.
Yeah, the anonymous point is a very big selling point, I'm sure, to a lot of those people. And I wonder if they don't even recognize a certain need until they see it. Like maybe they go on for nutrition and then they say sleep hygiene and they're like, oh man, yeah, I'm struggling to sleep. And I didn't even know it until I saw this like resource in this free hub. So I love that it's like all encompassing.
We try to make sure that folks know about this. So I really try to focus, I mentioned earlier, on meeting our new to practice nurses or even our new nursing employees from day two. I meet with them on day two coming into our organization, and I go over who I am. They all get my business card. They all know how to get a hold of me and reach me if they need to. But I also go through all of our well-being resources on day two. And then I go over it again when they're in nurse residency. And then I go over it again when I round with them. So like I just constantly am trying to make sure that it's at the forefront of their mind that all these resources are here for you and they are free.
Mhm.
So really just, encouraging folks to take the opportunity to look at them.
And I mean, it's a win-win, right? Because we're supporting our nurses who have the feet on the ground. And I'm sure it's improving retention for the facility, which in turn might be improving patient outcomes, which, as we know, drives the healthcare world. So it's like a no-brainer for me in so many ways. So I'm like shocked that this is like such a groundbreaking role because it makes so much
I
sense,
know.
and I'm sure it's cost effective. I forget what the price is of losing and training a new nurse, but it is horrific. I looked it up once.
One of the last statistics I saw was
Yeah.
67.
I was gonna say I thought it was like 50 or 60 for
Yeah.
every single new nurse you lose, which is like so crazy because you're losing the culture, you're losing like the familiarity of like the person on the floor. So I've always wondered why healthcare facilities don't like promote this culture from within. So it is so cool to hear that Jefferson is doing something like this because, like I said, it helps the nurses, it helps the facility, it helps the patients. So like bravo to you guys out there.
The trickle down effect, right?
Yeah,
I always,
totally.
you have to fill your cup before you can fill the cup of others. And I think that that's so inclusive of nursing that, we can't pour from an empty cup. If we're not fulfilled in ourselves and we're not taking care of ourselves, it's really hard to take care of other patients.
Absolutely. And hopefully we're gonna see more of a culture shift, especially after, the great burnout of COVID. Hopefully we'll see more of these rules opening up because you said it's a new 2-year rule,
Yeah, so
right?
so it started, I came into the role in 2022.
Yeah.
Right. right like in the fall of 2022.
Yeah, so that's like about when COVID was starting to clear. Yeah. And everyone was really burnt out. So it's really interesting to see like the ebb and flow of like the healthcare culture and like what it brings about. So, I mean, hopefully more of these roles will be opening up. Um, so how did you find this role?
So this is a very interesting story. I always
Yeah.
believe in nursing that I've been blessed with opportunities and connections, and that has guided where I've kind of gone in my career. So I'm a very active member in the Philadelphia Emergency Nurses Association. And 2 years ago, we had what we kind of had like an open meeting night where we invited nursing students to come in and ask members of the Philadelphia ENA any questions that they wanted to know. We had a really great panel of leaders, bedside nurses, new to practice nurses, etc. And one young lady reached out to me and said, "Hey, I'm looking to get a job over the summer. I'm a nursing student. I'm looking to get a job over the summer, and I'm having a hard time finding it because you know how in healthcare now, Janelle, we don't just label things as like dietary or nursing assistant. They all have fancy names.
Oh,
So
yeah.
yeah, she was just like, "Can you help me navigate this?" And I said, "Sure." And when I went on to the webpage at Jefferson, I was working within the enterprise, just not at these campuses. I saw a listing for program manager for nurse well-being. And I'll be honest with you, after reading the job posting and what they were looking for and the individual they were looking for, it didn't scream Kristen Gilmore. But I felt like this is a job that I would love to do. This really speaks to the work that I'm already doing in my current space informally. And I would love to be able to give back. And I applied for the job and I didn't tell anybody. I didn't tell my husband. I didn't tell my best friend. I told no one because in my mind, this role was never going to happen. Right. And then I got an email for an interview. And then I interviewed with panels and individuals for probably about 3 months. Yeah, before I was offered the job. So I really found out about the role by accident. I wasn't looking for a new job. Um, I was just trying to help another person and I came across it. And that's kind of how I ended up here.
I love that. I get asked all the time, how did you get into medical writing? And my story is also super funny and a lot about networking. And I started as a reptile writer, which is like not very professional sounding. I think that they want me to say that like I went to school for journalism and then like I graduated and I applied for this job and I did an internship. And I'm like, no, I started writing about reptiles and I like did this like lateral movement over there. So I always tell people like network, put yourself out there, apply for jobs that you do not think you're going to get because you never know where it's going to take you. So I love that you just reinforce what I'm always recommending to the
Never know.
people. Yeah, I mentor a lot of nurses and they're always like, well, there's like 100 applicants on this one. And I remember I got a job there and there was 210 applicants and I still got it. So I was like, you just got to put yourself out there. Someone has to get hired and it might not be you, but it might be you. So like go for it.
Yes, and that's how I felt when they were interviewing. And I didn't know this, of course, during my interview, but when they were
Yeah.
interviewing, there was folks from all across the United States that had applied for this job. I
Wow.
didn't know that. And there were so many applicants that they had to actually turn the job notification off so they couldn't continue to get more. Um, but again, to your point, I didn't feel like that the credentials matched what they were looking for, didn't match me. Um, and there's all these people, but I still tried and thought to myself, like, this would be so amazing. And 2 years later, here I am doing this work that I could never have imagined doing 3 or 4 years ago.
Yeah, and absolutely thriving and it just being like such a passion of yours. So, I mean, like credentials and your like clinical background and your like educational background like isn't everything. Like
Oh, it's
sometimes it's personality, it's drive, it's like wanting
character.
to support these people that
Yeah,
really speaks to people.
definitely. I think definitely character based. You have to be a dynamic individual to be able to call someone and say, "Hey, I heard you had a really bad shift. Let's talk about it and what can I do to help you?" You have to have a good comfort level in that. So, I think that was a driving force for me. But I agree with you. Always take the chance. You never know where it'll land.
Absolutely, totally. So I wanted to transition into like any advice for nurses. So do you have any advice for nurses who are struggling to stay in the profession? I've looked at the rates of nurses who are going to leave within the first year, nurses who are thinking about retiring, and nurses who are transitioning away from the bedside to other roles because they feel unsupported, they're burnt out, and they just don't really see themselves working in a healthcare realm that doesn't support their needs either physically or mentally. So do you have any support or any recommendations for people that feel like that?
Yeah, I think there's a lot there to unpack, right? So I think,
Yeah.
burnout is huge. We've experienced such a significant shift, particularly after the pandemic. And I talk about the pandemic a lot because I say, Janelle, you know, as nurses and everybody in the healthcare field, right, we were thrusted into COVID. We didn't know. We were afraid. There was a lot of unknowns. It was like we were in fight or flight for so long. And then COVID ended for like the rest of the world and everybody went back to normal, but we were never really given that period of transition. And I think that has proven to really have added to our burnout, right? We didn't get that period of like, okay, everything's done. We can take a breath now and we can take a pause and we can jump back in. It was like, okay, one day you're wearing your mask, the next day, all right, you don't need a mask anymore. Thanks for everything and keep it moving. And that's really hard, right? We were in fight or flight for so so I think that contributed to burnout a lot. One of the things that I think I always talk about with folks is you have to have conversations. You have to talk about it. As nurses, we carry so many bricks on our back, right? Our patients, our environment, our surroundings, what's going on in our home life, and all those bricks really add up. And I find that people, and you mentioned this earlier, nurses can sometimes be a little bit reluctant to seek out support and to seek out help, right? We're the people that are looked to for the support and the help, right? So I think reaching out to individuals, knowing who your support systems are, and really kind of creating those social networks. I can't say enough about social networks, especially in nursing. Nursing can be very isolating. We're at work for 12 hours a day, sometimes on holidays. We're working schedules that are very different than other people, typical 9 to 5 kind of folks. So creating social structures is really important so that you have folks to lean on. The Surgeon General actually just came out with a report recently that said isolation and loneliness has become a new epidemic within the world. And I think that our job sometimes adds to that in how we feel. So I think really creating good social connections, knowing who those support system people are and reaching out to them and truly allowing yourself those vulnerable moments to share what's going on. Because carrying them will do you no justice and will only bring you down further into that burnout spiral. I think taking also an account of what you feel like is burning you out and seeing if you can address it, right? Is it your schedule? And maybe you can have a conversation with your supervisor to say, hey, this is what I'm experiencing. What can we do together to kind of collectively look at that? And is there anything that we can do? Is it the patient population? Because sometimes, let's be honest, I was an ER nurse for many, many years, almost 2 decades before I started doing this job. And that job can be very challenging. You're seeing life, you're seeing death and everything in between. But I think that there's a really wonderful option in nursing, to be able to go and do anything we want. So I could want to be an ER nurse this month, and maybe next year I decide I want to be a peds nurse, and really just taking into account what's going on within you and what your interests are, and not being afraid to seek those interests, because just sometimes that change of environment and that change of pace or that change in population can really be so tremendous. And in healthcare right now, so many people work for large organizations that making that transition from one specialty to another can be so easy. You sometimes don't even have to leave, the organization that you work for. And one of the last things I want to talk about is really, looking for an organization that has programs that are embedded to support you from the beginning, right? Nurse residency programs are amazing. They really help to support nurses and new to practice transitioning into the role. Organizations that have well-being resources like myself are really so important because they give you the opportunity to speak. And with me, I'll share with you, Janelle, anytime individuals speak with me, it's 100% confidential and it's based in trust. So I don't go back and talk to their boss. I don't go and tell my boss about the conversations. It's really meant to be those moments of authenticity and vulnerability, and allowing people, the space to share what they need to share. And I will tell you that most times it's just that. People just need space to share what's going on. So really encouraging individuals to find organizations that have these type of programs embedded so that they can support you, because I think, recognizing that you're struggling and speaking to it can be so powerful and really can help to reignite that why, that why that we talk about when we become nurses. So I think using those resources to help you recognize that again is so important.
Oh, so much to pack. Once again, taking notes on the side, taking notes on the side. So you mentioned having a social group. I cannot agree more on that. I have like a really robust social life. And I'll also mention that I think you should have a social life within the healthcare system, but also outside of the healthcare system, because I'll notice when I get together with my healthcare system friends that they just perseverate on the healthcare system and they'll talk about their bad shifts, which is awesome. It's a very debriefing moment, and I understand that it's very cathartic, but I also feel that I need to step outside of that conversation a lot of the time. Like I was at a wedding recently with one of my paramedic friends, and they just got onto a trauma unloading moment with me, and I was very happy to be there with them, but it just brought to the forefront of my mind that healthcare workers can never not be on in a certain way. That I was next to my husband, who is an engineer, and he was talking to a chiropractor, and they weren't talking about their mental health problems at this wedding. So, also just being able to step away from that demographic and have like lighthearted conversations from people that I guess like aren't aware of like the hardship. So like having that like yin and yang, like knowing when to like lean in towards your like brethren and knowing when you need to just like lean away and just have like a like a D like a step back.
I agree with you. I'm married to a paramedic. Um, so I totally can understand that. And one of the things that I think we're really good at is we don't really talk a lot about work or about, stories, but we talk about it when we were both in the clinical space of like when we needed support from each other, to your point, when there needed to be that like debriefing moment of like, I just saw something really bad and I need to talk about it. But I agree with you. You have to have that balance of like your healthcare people and then your non-healthcare people, because you can't always allow your brain to live in the healthcare space, right? That's not sustainable. My best friend is an English major. So very rarely do we ever talk about healthcare kind of stuff. And I'm so thankful for that relationship because it allows me to be Kristen, that's not the nurse, right? And I think that sometimes when we become nurses, it becomes almost like this persona that we take on, that if you took away the nurse, then it's like, well, what else is there, right? So I
Oh
think
my
that,
gosh.
yeah, I think that having structures and hobbies and supports and all the things outside of nursing, recognizing that nursing is just one piece of you is so important.
Yes, yes. My friends talk about that. They're like, oh, Nurse Janelle is always on. Nurse Janelle is always on. And it's true, though. It's true. Like, they will get like little cuts and they'll like run up to me, and I'm like, guys, you don't need me. It's just like a little blister. And
Yeah.
first of all, like, let me not be a nurse. Like, just because you are bleeding does not mean that I need to dress your wound. You're fine.
Right.
But being said, like that, like doesn't happen. Like my friends that are a web designer, no one's coming up to them with a computer around the fire. You know what I mean? So it's a very different persona. So yeah, I totally get what you're saying. And then you also talked about, let's see, taking a step back from a particular role if you think that that population may be increasing your burnout rate, or maybe something about that role is increasing your burnout rate. And I definitely agree with you there. I think that nurses also have to let go of this nursing identity, like you said. Like, I'm a pediatric nurse. I stay with this. I call it like the nursing martyr. I think that nurses really struggle with this concept of nurse martyrdom. It's our calling, and that the idea of patient-centered care almost doesn't leave room for the nurse evaluating whether they're like happy, or if their like physiological needs are met, or like their mental health needs, which I think is incredibly fascinating because patient-centered care is a model of care. It doesn't mean that we need to sacrifice like everything. So I think that they really struggle in taking a step back from this identity, and they almost see it as a sign of weakness to say that the role itself might not be serving them in their mental health, because at the same time, it might mean that they're not strong enough to serve their patient. So I always really implored nurses to think that just because a certain role or maybe the hours or maybe the patient demographic is not serving your mental health, that doesn't mean that you're less of a nurse. It doesn't mean that you're not strong enough. It just means that this isn't quite the best puzzle piece for you, like how we talked about finding your place in the world, and that there's no harm or shame in taking a step back and finding a different role, or even taking like a mental health day, a sick day, whatever they need to do to really like soothe and heal their soul, because we also can't provide the best care for patients when we're burnt out, when we're exhausted, when we just aren't like at the full capacity. So I really like that you mentioned that we can take a step back from the role in general, because nurses do have such an identity pulled towards that specific role. So I love that you brought that up.
Yeah, and I think just recognizing like you also might be somebody who's been in a role for 10 years. Well, the person who took that role 10 years ago isn't the same person of today. So maybe you have new interests. Maybe you're excited to be a nurse researcher. Maybe you're excited to go be a labor and delivery nurse. Go do those things. Get yourself excited again about nursing. We were all so excited when we started about the unknown and everything we're going to experience. And I remember being so excited when I first became a nurse. Like, go find that. That's somewhere else. You can go anywhere and find that in that place. And that's what's great about nursing is all the possibilities.
Yeah, I also think that your body changes too. Like I was like, oh, I am such a night person. Like I'm gonna work nights and I love running around and I'm just gonna run around all the time. And then I started doing it and I was like, I am so decrepit. Like I feel terrible doing this.
Yeah.
And I don't think I can do this for like the rest of my life. So like the mental spark change, but then also I had this like realization of like, I don't think I can do this when I'm 50 or 40 or like even in 5 years. Like I like my physical body started to burn out within like the first like 3 years of that type of lifestyle that I was so excited to join. So like also just reflecting on what your physical body is capable of too.
Yeah, it's listening to yourself.
Yeah, which nurses are not the greatest at doing. That patient-centered care again. So my other question is, what do you think facilities can do to improve retention for nurses? I think the most obvious one is having the role that you are in right now. Like that is definitely the coolest thing I've ever heard. And also having those resources, like that
Yeah.
QR code, that anonymity is so cool. But what else do you think that facilities can do?
There's tons, right? And it doesn't have to be anything that's huge either, Janelle. Like if you're a small facility and you're thinking to yourself, like, we don't have the bandwidth to have all these resources, that's fine. There's so many things that you can do in your own unit. Like talk about recognition. Like the Daisy program is out there. We now have an award called the Bee Award because you can't have daisies without bees, and you can't run a hospital without people outside of nursing. So our Bee Award is meant for anybody who's not a nurse that helps to support patients. We do recognition boards. We do employees of the month. We do things that are just fun. Wellness Wednesdays is what one of our nurse managers is doing, where they're doing like fun artistic things. Like right now, they're making a turkey with things that they're thankful for, like just simple things that really just elevate the environment that you're in. It helps to develop a team. It helps to collaborate with folks, right? It creates a really nice dynamic. So those are little things you can do. You can almost always model various approaches that other organizations have on peer-to-peer support. So there's a wonderful program. I'm going to plug it. It's called the RISE program, RISE. Folks that aren't familiar with it, RISE stands for Resilience in Stressful Events. It is a program out of Johns Hopkins University Hospital. And really, it's a group of individuals in your organization that go through education as it relates to psychological first aid to support each other. And we do that here at Jefferson, and we do it on a large scale, but it most certainly could be done from any organization on a smaller scale. So creating structures to support each other is also really important to help with your retention and also your resiliency. I think, also looking into nurse residency programs, because that helps to create a community. You're sitting in a room full of people that are in the same space you are, right? You're all new to practice. You're all trying to learn how to be a nurse. You're trying to learn how to be a professional. You're trying to learn how to communicate differently. So it can be a lot. So you're creating a new social system for yourself with that group. And in the same breath, in nurse residency, you get to meet all the people in your organization who come to work every day to support you, whether that's risk, quality, education, pharmacy, nursing, all the people. And you really get to create that network, that you talked about to support you. So I think, having those nurse residency programs are really important. Having folks like me are really important. Individuals that can be easily accessed to have conversations to support people, whether it's, again, it's a work issue, it's a home issue. We deal with domestic violence issues. We deal with, child issues. Whatever you need, I come to work every day to serve. And that's really what we do. So I think just having those, whether it's a small incremental department-based thing to celebrate each other, to support each other, whether it's creating shared governance structures so that nurses have a voice at the table to create change, right? Sustainable change. I think that can be something that's very easily done on a unit-based level as well. And then you have the organizational pieces where it's like having things like a RISE program, having programs like Mayan, nurse residency programs. I think all of those things, whether they're large or small, can really snowball into helping with your retention with your nurses.
Amen. Amen. I feel like I love how you addressed it from a small facility to a large facility, multiple different stakeholders there. I think that a lot of the time when we talk about nursing retention, it's just pay them more, pay them more, pay them more. And that's not necessary.
Thank you for joining us on this informative journey through the world of Nursing Now podcast. Connect with Janelle on LinkedIn, dive into our newsletter, and enroll in our course to unravel the exciting world of medical writing and unconventional nursing. Stay tuned for more narratives that shatter boundaries and redefine the essence of nursing.